welcome and thank you all for taking the time to join this call, and a big introduction to our three regular medical doctors, Dr. Avi Patil, Dr. Brandee Waite and Dr. Patrick Burns, who are here to give you an overview of the races, their main topics, and then also to answer your questions at the end and those that have been pre-submitted. My name is Sam Fanshawe and I'm one of the event directors at Racing the Planet, and I am just here to coordinate the call with the experts. We have a lot to get through today, both with what they want to introduce and also the questions from all of you. So I'm not going to spend too much longer other than to quickly say between these three medical doctors, they have nearly 60 races of experience of working at a Racing the Planet Ultramarathon. And then also Dr. Patrick, who has raced with us in Patagonia in 2017. So we have a lot of good experience here to answer your questions and give you as much information as they can in the limited time about how the races work. So on that note, I am going to hand you over to Dr. Avi, who's going to start with the introductions and then cover his core topic.
Thanks, Sam. Great, and welcome everybody. Thanks for joining us. We are super excited to be here with you guys. And yeah, I'll be introducing Dr. Brandee and Dr. Patrick a little bit later, but like Sam said, we've all been to a lot of races and have a fair amount of experience, so we're excited to be here. Sam, next slide, please. We're really lucky at the staff that we are able to attract to these events. We really get the cream of the crop. We're mostly emergency medicine doctors, some sports medicine doctors. A lot of us have wilderness medicine training, and really the reason why we're able to attract such great people is a true testament to sort of Sam and Mary's attention to detail and safety. It makes us feel very comfortable that we're putting on very safe events. So it's the main reason why we come back over and over again, because we feel really comfortable with how things are organized and so forth. So, oh, that's great, Sam. You can, yeah. So I just want to spend a little bit of time talking about kind of pre-race planning, what you guys can do to prepare yourselves before you even come to the race. And it's really important for you guys to train. I mean, that sounds obvious, but it doesn't always happen. But to train with the pack that you're going to use, with the shoes and socks that you're going to use, try the food and the supplements that you want to take and eat during the race so that you're very comfortable with it, to avoid any surprises. The other thing that is important for you guys to do is talk to your own doctors at home to sort of tell them what you're doing and how they can help with your planning as well, and to go over with them any particular medical history that you might have, so that we can come up with a safe plan for you individually, whether it's your own medical history or things that we might run into. And it's important for you to get us those forms as quickly as possible, as soon as possible, so that if there's any concerns at all, we can have a conversation before to come up with a safe plan. So once we get to our location, from a doctor's standpoint, we're going to go over your electrolyte and calorie plan kind of individually when we do your gear check-in. And so we'll make sure that you have all the right things that you need. And if you don't, we might ask you to go buy more food or find more electrolytes. And so just be aware that bring everything with you that you think you might need. And then we'll go over your blister kit that you're going to bring as well. And if you have any questions on how to use it, we can talk to you about that as well. And Patrick will be talking more about blisters in a little bit. So keep in mind that we are in the middle of nowhere, right? The reason these races are so amazing and so beautiful is that we pick just these beautiful locations, but we are very remote. And so while we have a really qualified medical team and we bring a lot of safety equipment, we're a field hospital essentially. And so we have long transport times to hospitals, we have limited communications, and we are working with a hospital system that's the local hospital system. And we have done hospital visits to these locations. We know exactly what their capabilities are. But just this is something to keep in mind when you're trying to push yourself, is that we do have, we are a remote race. So as you are running, this is our typical checkpoint. And so throughout the day, you'll see these checkpoints sort of every 10 kilometers-ish or so. And this is where there'll be a doctor, maybe two, either at the checkpoint or in a roving vehicle that's driving between checkpoints. And so you'll have a lot of opportunity, if anything happens at all, to talk to a doctor and ask them certain questions. And this is where you'll refill your water and we'll check your times and so forth. So this is what you're going to see throughout your day. And then back at camp, we have a medical tent set up. This will be, we'll all be camping together. And so you can come see us at the medical tent if you have any questions at all. There will always be a doctor at camp. So even in the morning, when most of the doctors are gone to sort of set up their checkpoints, there'll be a physician at camp too. And in the mornings, we typically don't do any non-emergent care like foot care and blister care. But if you have any emergent needs or any really concerning needs, there will be a doctor at camp in the morning. But in the evening, when you get back from your race, come see us if you have any issues at all. And so these are some of the issues that we see. Most of the issues that we see are very minor injuries, blisters, ankle sprains, things like that. We always like to plan for the worst case scenario. And so we plan for the worst, but we hope for the best. And, odds are, because of our planning and your training and how much care that we take during the course, we usually only see really minor details, but we want to make you aware of some of the more serious injuries that can happen. I'm going to talk about electrolytes in a few minutes. And this is sort of the thing that everyone has a lot of questions about. And Sam, you can go to the next slide. This is the thing that people have the most sort of concerns, anxiety about. Electrolyte abnormalities during a race are very rare, especially with education and understanding how things work. So I just want to go over a little bit about how things work so you can sort of think about what your strategy is for your electrolyte and water balance. And so there's lots of electrolytes are important, but sodium is really the one that we get the most concerned about because it's the one in your body that controls all your fluid balance. And so the way you lose sodium in your body is sweat, urine, and in your stool. And then the way you can replace sodium is either sodium supplementation or the food that you're going to eat, which is a big chunk of the sodium that you get. And then you lose water, again, in urine and stool, in sweat, and then breathing, actually, you lose a lot of water just through respiration. And then the only way to replace fluids is, of course, drinking. And the two big variables here, or the three, in sodium losses, the big variable is sweat. And so we all sweat a different amount of sodium, and it's hard to quantify to understand how much sodium you're losing. And the big change for those of you who train in cool climates and are coming to a hot race is that you just sweat a lot more when you're not used to it. And so you can get acclimatized over time. You do get acclimatized to the heat. That typically takes about 1 to 2 weeks for full acclimatization, but it starts right away. And what acclimatization is that your body becomes more efficient in cooling. So you get more blood flow to your skin to sort of release more heat. You start sweating at a lower temperature, but you also decrease the amount of sodium that you secrete in your sweat over time. But remember, for full acclimatization, it takes about 1 to 2 weeks. It starts right away and you start gradually getting acclimatized even in the first few days. And the other thing that you have control over is how much water you drink. And we'll get back to this in a few minutes. So how much sodium do you need? This is the big question that everyone asks us. And like everything in medicine, really the answer is, it depends. So we talked about acclimatization, we talked about sweat sodium content. And so really, this is an individualized question. And so this is why it's important to train with sodium supplementation to kind of understand how it makes you feel, what you're used to, and so forth. If you look at the recommendations, they're wild. I mean, the ranges are anywhere from 300 milligrams per hour during an endurance event to up to 2,000. And so that's just I don't even know how you sort of wrap your head around that, such a wide range. Most experts say about 300 to 600 milligrams per hour. And so you can look at your sodium supplementation and see how many milligrams that is. But again, this changes with heat, with how much exertion you're having and how many hours that you're spending on the course. One thing to keep in mind is that sports drinks like Gatorade and Powerade really just have very low sodium. So these are really just sugary drinks that taste good. They're not really true sodium supplementation. So the one thing that we fear the most, which again is very, very rare and unusual, is too little sodium that can then cause symptoms. And sodium causes fluid shifts in your body. And so if your sodium is too low, you get water that diffuses into your cells and you can get swelling, which can cause a lot of symptoms. And so we all have a hormone in our body called antidiuretic hormone. And when our blood gets too concentrated, we secrete this hormone and it makes our kidneys sort of hold on to water and not release water in your urine. And so we all have this. This is a normal response, but sometimes, next slide, please, Sam. Sometimes we get an inappropriate secretion of this hormone. So we get secretion of antidiuretic hormone when we don't need it to be. And the thought is that there are certain stressors like pain and nausea and things that you feel when you're running an endurance event that cause an inappropriate secretion of this hormone. Your kidneys hold on to more water than it should, and this causes an additional component of dilution of your plasma, and you get low sodium. This can cause some weight gain during a race because you're retaining water. You can get a little swollen and puffy, and it can cause you to not urinate despite drinking a lot of water. And like I said, this dilutes your plasma, then water moves into cells and causes them to swell. The symptoms are really challenging because these are symptoms that you're going to feel even during a normal ultramarathon or if you're overheating and kind of feeling early signs of heat stroke. So dizziness, nausea, headache, vomiting. Sometimes people feel short of breath. And then the symptoms that we really fear, which again are very rare, are people get confused. They can have even seizures, and then you can get a lot of swelling in your brain. So the risk factors are, the biggest risk factor is just drinking too much water. So people just overconsume water. They're drinking free water, and which is just pure water, not water with electrolytes. And the risk factors that we sort of have figured out are spending more time on a course gives you more time to drink water. And this has been studied in front country marathons, like the Boston Marathon. In those who had low sodium, over half of them took more than 4 hours, and a small percentage of them took less than 3.5 hours. So just keep that in mind. If you are taking longer during the day, just be a little more cognizant. You do need to drink more water because you're in the sun longer and you don't want to suffer from dehydration, but just keep in mind that there is a balance between dehydration and hydration and overhydration. So if you feel any symptoms, the best thing to do is just to come talk to one of us. We're available throughout the course and in the evenings, and we might make you just rest a little bit. We might tell you, well, why don't you sit down at the checkpoint, take a few minutes and rest. We might ask you to take a few extra pills of your salt tablets. And then the antidiuretic hormone has a very short half-life. So in 15 to 20 to maybe 15 to 30 minutes, your body starts to break it down and it no longer is effective. So what you'll find is once you rest for a little bit at a checkpoint, you're going to suddenly start urinating a lot. And that's your body just not responding, or sorry, the action of the antidiuretic hormone is eliminated and you start releasing water through your kidneys and you start peeing. If you have severe symptoms, we are well equipped to handle this. So if you start having some confusion and hopefully not seizures, then we have IV fluids that are really concentrated sodium that we can give you. Again, I don't want you to be stressed out about this. This is very, very rare, but I want you to be just aware of this so you don't have any symptoms of overhydration. So the challenges that we see is that people don't have enough time to acclimatize to these hot climates. These are really non-specific symptoms. So the same symptoms for just being exhausted from running, heat stroke, as well as low sodium. They're all sort of very similar symptoms. So that's why we're there to help you kind of tease out these symptoms. we find that people deviate from what their plan was. And it's okay to deviate, but you got to be aware of why you're deviating from your plan. So people don't urinate, then they think they're dehydrated, so they drink more water, even though they drank a lot of water, but really it's because your kidneys are holding on to this fluid. And again, the challenge is to balance hydration versus overhydration. So how do we prevent this problem? Again, it's very rare. If you can, try to come early to sort of acclimatize to the heat. We really emphasize drink when you're thirsty. So when you feel thirsty, drink slowly and steady, and don't just sort of pound a ton of water. Take supplementation that you've been training with. And if you're coming from a cold climate to a hot climate, maybe consider bringing extra sodium supplementation than what you're training with. If you're not feeling well, consider some short breaks at checkpoints, and really use the evenings to sort of rehydrate slowly, eat some food and rest. And then we are always available to you if you have any concerns. So don't be afraid to come talk to us. The goals of the medical team is to really help you finish the race. We're not there to sort of pull you out of the race. We want to do everything we can to help you succeed. Next, I want to introduce Dr. Brandee, who is a sports medicine expert. She's a professor at UC Davis, and is, like Sam mentioned, has been to many, many races, is a dear friend of ours. Take it away, Brandee.
Great. Hopefully everyone can hear me okay. Thanks for that wonderful review, Avi, taking us all back to med school, or to med school for the first time for many of you. I'm going to talk about the musculoskeletal or sports medicine issues that come up. That's really my my favorite thing to talk about. I'll give you some sports med anatomy basics, just so you can understand a little bit of what we'll talk about. So in sports medicine, we take care of a lot of joint problems, joint, muscle, and bone. And so in general, any place you bend, fingers, jaw, shoulder, elbow, wrist, hip, knees, ankles, is a joint. And so you've got two bones that come together, and then there's a little cartilage coating over the ends of the bone so they can glide very smoothly. When we're young, they glide like ice against ice. When you have arthritis, it grinds like gravel against gravel. And so hopefully we don't have too much advanced arthritis coming in. It makes it a little bit of a challenge, but not impossible to deal with. And then you have the muscles and the tendon. So the muscle is the meaty part that everyone knows about. You strengthen your muscles. The tendon is the gristly part of the muscle that attaches to the bone. So on the picture where it says tendon versus ligament, you can see the red meaty part of the muscle. Then you can see sort of the white gristly part of the tendon that attaches to the bone. When the muscle contracts, that tendon stays in it doesn't really contract, it stays fixed. It's very fibrous, and it helps to pull the bone where you want it to be. So that's how you generate movement. And then we have ligaments. So tendons connect the muscle to the bone, and ligaments connect bone to bone. So they don't stretch or contract. They're there for support and for structure. And I just mentioned this so you have a little bit of basics for the things that we're going to talk about. You can go ahead and hit the next slide, Sam. So our most common problems that we see in musculoskeletal or sports medicine issue on the races are mainly tendinitis problems. So that's a problem of inflammation of that tendon, which is what attaches your muscle to the bones. Now, many people go through these races and many things hurt, right? You have aches and pains, right? That's to be expected. You're running a very long distance over beautiful but challenging terrain. We would expect that people will be sore and have aches and pains. But a true tendinitis is more specific inflammation in the tendon. So you're overusing those muscles, the tendons are getting overused, and so the tendon gets inflamed and irritated. And the most common places that happens is at the outer hip, kind of at the flare of the hip, in the knee, or right above and right below the kneecap, and also in the ankle, so the front of the ankle or the back of the ankle. So with that tendinitis on the outside of the hip, it's from your gluteal muscles or buttocks muscles where they attach to the outside of the hip. And these also get a lot of pressure when you're sleeping on a hard surface on your side. So sleeping on the ground plus running a lot can really flare those outer hip tendons up. In your knee, obviously, we're doing a lot of climbing, a lot of descending. And so the quadriceps tendon, which attaches your thigh to your kneecap, or what we call the patellar tendon, which attaches your kneecap to your shin in front. Those are areas where people can can get pain. And then also in your ankle, both the muscles that lift up your foot in front that help you to take a step, and then your Achilles tendon or the plantar fascia, which both help you push off. So in all of those areas, it's great to have a good stretching program, and know if you already have a problem area there when you're training, you want to see your local sports med doc to help you get a good treatment plan, because if it's bothering you while you're training, it will probably bother you during the race. It doesn't mean it has to be a race ending issue, but if you know you're having trouble with it before you head out to the race, it's something that you'll want to address. And then also patellofemoral pain. So instead of being a tendon problem, this is a problem where the picture shows there kind of the cartilage on the back of the kneecap just gets really irritated from the repetitive bending and straightening, and it gets irritated and inflamed between the thigh bone and the kneecap. So these are probably the number one musculoskeletal problems, plus things like ankle sprain, like if you twist your ankle going over the boulders or rocky areas, or even walking just in soft surface or sand, that can happen. The lower extremities are, your legs are the most injured. Sometimes people can get a back strain. It's rare to get shoulder or hand problems other than just pain from your backpack being on there, or if someone has a trauma, like we've had sometimes if people fall and catch themselves wrong, you can have a dislocation of your elbow or your shoulder. But that is pretty rare. I've been to 20 races, and I can think of maybe 2 times that I've seen someone dislocate a joint, and that's always because of a fall. So if people pay close attention and slow down when they need to slow down, it's very unlikely that they would fall. So they can completely avoid those situations just by being a little bit mindful on the course. And so the prevention here is really key. So these are the things that you can do to help prevent these problems from starting. And there are things that we can do to help treat them. But for you to prevent it, really stretching can be very helpful in preventing tendinitis. So stretching the affected tendons, usually stretching at the end of the day, or even taking a little time to stretch at the aid stations or along the course if you're starting to feel more than your normal amount of running pain. Stretching those areas while you're going through your training now. Doing a little bit of cross training with strength training can be very helpful in preventing tendinitis. You're not going to cross train when you're at the race. That's just ridiculous because you're going to be exhausted. But in training up, doing some cross training with lateral movement. So when you run, you're just basically running forward. So the muscles that move you forward are the ones that get really strong, but you need those muscles that move you side to side as support. So doing some strength training for your glutes and for the side to side muscles can be really helpful in preventing tendinitis, especially in the hip or the knee. And then when you're doing your training for these races, or any race really, you want to avoid overuse or an injury that can happen if you increase your training too quickly. So in general, we recommend that you increase only about 10 to 15% of distance per week with your training. Obviously, you don't train to run nearly as much as you'll actually run during the race. So you'll run a lot more than that during the race, which is fine. That's what it is. But to prevent starting these problems while you're training, you want to make sure you don't try to gain too much too fast. Also, try not to change 2 training parameters at the same time. So don't change your distance and your speed. Don't change your terrain and your distance. Don't change your shoes and your speed. So if you're going to be making a change during your training, try to make just 1 change at a time and not 2. And that can really help avoid injuries, particularly for the patellofemoral pain or pain at the front of the knee. If you can strengthen your glute muscles and stretch your quads, which are the muscles in the front of your thigh, your hamstrings, which is the muscle in the back of your thigh, and your calves, because your calves actually, we think of them as the muscles that help push off with your ankle, but they actually cross the back of your knee and help with bending your knee as well. So those are things that you can do to help prevent those problems well before you even get to the races. As Avi said, no last minute changes. So you want to train with the things that you've trained on. Don't buy a new pair of shoes, a week before the race and not have time to try to get into them. Anti-inflammatory medicines versus pain medicine. So people will have aches and pains in their muscles. In general, so they have different names depending on where you come from. In the States, the NSAIDs, which are non-steroid anti-inflammatory drugs, are medicines like ibuprofen, Aleve, Motrin, naproxen, naproxen, Advil, and I think in the UK, Nurofen is one of the names that it goes by. And those medicines are anti-inflammatory. They decrease inflammation, so they can really help with pain. However, they are metabolized through your kidneys. Your kidneys are going to be challenged already because you'll be dehydrated and you'll be breaking down a lot of muscle when you're running that much. And those muscle cells have to be cleared through the kidneys. If you don't have enough fluid, they have to be cleared through the kidneys. So we really don't recommend taking those anti-inflammatory medicines during the race. So something like Tylenol or paracetamol, which is an analgesic, is a better thing to take for your muscle pains during the race. But then perhaps at the end of the day, each day during the races, when you're ready to relax and when you have access to kind of drinking more water, then if you want to take an anti-inflammatory at the very end of the day only, would be recommended if you need to take something. Many of you won't need to take anything or choose not to take anything, which is fine. But if you're going to want to take something, Tylenol or paracetamol during your race, maybe an anti-inflammatory at the end of the day if you feel like you need it. There are also topical anti-inflammatory creams that can be very, very helpful for treating muscle and tendon and joint pain during the race, and they don't have much of an effect on your kidney. So things like diclofenac gel, Voltaren gel, Asper cream, Salonpas, all of those different sort of pain creams can be very helpful, and they don't affect your metabolism status at all. So those can be really helpful. Also, this is really key to get any potential treatments before the race. So the med tent has fantastic doctors in them. They are not going to be doing pain injections. We don't have the capacity to do that. So if you're hanging out with a Morton's neuroma or a knee joint pain or a tendon pain or something that you're thinking, maybe I need an injection, but maybe not, I recommend you just go ahead and get that injection before you come to the race. Maybe 1 to 2 weeks before is probably ideal. Don't get it the day before you travel. If you get it 6 weeks before you travel, it may or may not still be helpful while you're traveling. In general, cortisone injections last about 3 months for people, or steroid injections last about 3 months for people, but some people are unlucky and they only last about a month. So you want to try that out. Again, we won't have the capacity to be able to do it in the medical tent. The only way you'll be getting an injection for pain is if you've pulled out of the race and are at a local hospital. And I haven't looked at the chat at all, but I will do that after I stop talking. And I think that was all I had to present to start off with, and I'll answer lots of questions afterwards or in the chat. And so next we have the fantastic Dr. Patrick Burns, who will be talking about the #1 reason that brings people into the medical tent at ultra endurance event, and that is feet. So take it away, Dr. Burns.
Thanks, Dr. Brandee. Very excited to be here. Yeah, I agree. I think this is the most common thing that we see on these races. And I'm going to talk a little bit about what we know about blister prevention and blister care. There's a lot we don't know, but there's some that we have research on. And so I'm going to go through what we know and what things have helped and how to treat your blisters and how to prepare your feet. But I want to make sure that we leave time for questions. So hopefully these blisters here on this foot aren't so bad. Hopefully yours won't be that bad either. But we want to go through and help you figure out what you need to do to prepare. So you can just go to the next slide. Okay, so let's talk about the factors that affect blister formation. So a blister is a shearing of the superficial layers of the skin. And in that shearing force, it creates a potential space where fluid kind of collects. And that's what we call a blister. Lots of things affect the formation of blisters. The frictional forces affect the formation, moisture, humidity, river crossings, terrain like river crossings or sandy areas or different slopes as you're going uphill or downhill can increase your blister formation. Also, people don't think about this, but changing your own body weight, including like the weight of your pack on you, the heavier the pack, the higher the frictional forces are. so they can lead to more blister formation. All the more reason to echo again what Dr. Avi and Dr. Brandee said. It's important to train with the gear that you're going to use out there, so that your body understands what's going to happen to it. So let's go through a couple of prevention kind of thoughts out there. So first off, thinking about antiperspirants and powders and lubricants. Remember I said, at least for antiperspirants, one of the factors that affect blister formation is moisture and humidity, river crossings. So there's been a lot of thought that maybe antiperspirants would be helpful to dry out the feet to make blisters less common. Some research was done into this, looking at like over 600 military recruits going on a 5-day trek where they're putting antiperspirants on their feet in order to help. It did show that it decreased blister formation slightly. However, there was an increase by almost 50% of the amount of like skin irritation that people were getting on their feet. So it's not totally recommended to use an antiperspirant, and definitely, if you are in the camp of people that want to use them, I would highly recommend trying it out and using it consistently before to make sure you don't get those skin reactions. Next up, we have powders. People like to dry out their feet for similar reasons with powders like Gold Bond or Dr. Scholl's. These powders can dry up your feet. The problem is there's this theoretical problem of all that powder clumping up inside your shoe while you're running, and it causing increased friction and causing more blister formation. So I would also take caution with that. I think a better idea is to dry out your feet at the end of the race day. Maybe use a powder then if you feel like that's necessary, but probably avoid those during the race. Also with lubricants like Body Glide or silicone lubricants like hydrogel, there's a little bit of mixed data on that. So the idea of the lubricants is that it will reduce that frictional coefficient again to help reduce the blisters. The research that's been looked into this is using these kind of greasy lubrication will decrease that frictional coefficient by about 30%, but it's only going to last about the first 2 hours or so of your racing. After about 3 hours, research has shown that there's about a 30% increase in the amount of frictional forces that people have. So if you are going to use lubricants during a race, you might want to think about reapplying, a couple hours into the race, especially on that long stage. When you're out there for a while, you might want to reapply a couple of times. I would suggest going more towards a silicone lubricant rather than a greasy like Vaseline. Even better, it might be better to just wait until the end of the day and moisturize your feet with your lubrication afterwards. Great. Okay, next for prevention, we have a little bit of research looking into pre-taping or not to pre-tape. If you are somebody who is prone to blisters, it's actually recommended to pre-tape over the area that you're going to form these blisters in. A thin piece of very thin, very slippery but adhesive paper tape can be helpful for that. And I'll talk a little bit about how to tape in a couple of slides. But if you are somebody who is not prone to blisters, the research has shown that it actually, if you kind of prophylactically pre-tape your foot in places that you don't blister, you tend to increase the amount of blisters that you get. And especially if you're wearing Injinji style toe socks and you have tape under there and that you're pre-taping and you don't tend to get blisters there, it tends to increase the blisters. So again, if you know that you always get blisters in the same spot, and if you know you get blisters in the same spot, it's a good idea to put a thin piece of paper tape like you can see on the picture here. Let me just talk quickly about how to pre-tape a toe, and then we'll talk a little bit more about that on the treatment aspect too. So when you're pre-taping a toe, go back, sorry. If you want to take like the 1 inch paper tape here, and you want to go top to bottom around the toe, and then you want to do a circumferential piece of tape just to seal it in place there. The best idea is to keep that seam of the tape on the top or the bottom of the toe, just not on the sides, because any sort of non-smooth area rubbing up against another toe can cause increased blisters in the toe that's next to it. So you want to be mindful of that. So always keep your seams smooth, and that will help prevent blisters. Other places on the foot, just a single piece of paper tape should be sufficient for pre-taping. Go to the next slide. All right, let's talk about socks for a minute. Again, train with the stuff that you're going to run with. It's a good idea to use some kind of synthetic sock or moisture wicking sock, or wool can be helpful. Try to avoid cotton. They tend to hold onto moisture. Anecdotally, some people really find that wearing 2 pairs of socks can be helpful to reduce that frictional coefficient. Me personally, I wore almost these 2 exact socks. I always wore a pair of Injinjus underneath and then another pair on top of it, and I did decently well. Again, that's anecdotal, but these Injinji socks have shown that you can decrease, especially those toe blisters, because each toe is kind of separated and individual. That can help. It's a good idea to have a dry pair of socks to change into. If there's a river crossing, then you can dry off your feet that way afterwards and put on a fresh pair of socks that are dry. As far as go back to the shoes. As far as shoes, just going back to training what you run with, don't buy a new pair of shoes. Make sure they're adequately broken in. You can consider doing waterproof shoes in certain terrains. If there are going to be a lot of water crossings, they can be helpful. The Gore-Tex ones are breathable, but just remember that Gore-Tex that's keeping the water out will also keep the water in and might make you prone to more blisters with that increased moisture. So make sure you train with the stuff that you're going to be racing in. Some people will recommend going a half a size up on the shoes that you're going to be racing in to accommodate for some swelling of the feet during the race day. Again, it's important to know what your body's going to do. It's going to be different for everybody. So make sure you try out your gear and know what you're dealing with. Great, we can go to the next slide. Okay, so treating your blisters when you have it, we don't expect you to do the blister origami that you see on the screen right now. But this is a self-supported race. We want to empower you to be able to take care of your own feet as much as possible, and we are here for your consultation whenever you need us. But and we'll definitely help you out. But the more complicated things, we can show you how to do that out on the field. On the slide. Okay, so the big question is, so when you have a blister, how do I treat this? If you've never popped a blister before, it's very easy. You want to take a clean needle, either a needle or a safety pin. You want to clean it off. If it's sterile, great. If it's not, then you can take an alcohol swab and clean it off, or you can flame it with a lighter in order to sterilize it. And then you have to decide whether or not it's something you want to pop or not. General teaching is, if it's small and it's not painful, don't pop it, leave it intact. You want to keep that biological dressing intact as much as possible in order to reduce that pain. Once that top layer of skin comes off, the pain increases. So you best to try and leave it alone if you can. If it's large and fluctuant and uncomfortable, then popping it can be helpful. You want to make sure you take your needle and insert it and blot out the fluid that's inside, but you want to keep that biological dressing intact on top before you start with your taping. So here on the right-hand side of the screen, this is a blood blister. Okay, so this is a big blister that's filled with blood. This indicates that the blister is a deeper layer of skin than the blisters that you're seeing on the other side of the screen. And the reason we worry about that is that it's more prone to infection because it's closer to a blood supply. So we really recommend not popping them unless they're large and fluctuant. And if you do, it's probably best to come and see the medical tent to talk to us, because we want to make sure that we know we can monitor for signs of infection as well. So try and keep them intact if possible. Go next slide. Again, your blister kit and your mandatory check-in gear, you can refer to your gear list for what you need, but this Racing Planet has a great kit that has everything that you need in it. When you get to taping, so taping isn't very complicated. You really want to create just a protective barrier. So after you've popped your blister, or even if you haven't popped your blister and it's not big or painful and you just want to cover it, start with a piece of paper tape, cover it just over the blister, and then you can take a thicker piece of elastic tape like Elasticon or rock tape or Leukotape or something that's going to provide a little bit more of a protective barrier or cushion, and cover that paper tape. Try and keep this on as long as possible. The stronger Elasticon tape or rock tape will stay in place for longer than the paper tape alone. So you really want to try and not disrupt it as much as possible, because again, that biological dressing that's over the blister, the top skin that's on there, you want to keep that intact as much as possible. And then putting down this layer of paper tape first, which is less sticky, won't tear it off in case that bandage falls off. If the skin does come off, that biological dressing does come off, there's a couple of other products that can use. Second skin is great. So as you can see here, the biological dressing has come off the bottom of the foot. It's painful, it hurts. So you really want to put a colloid dressing over it that kind of acts as that protective barrier. So second skin works for that. If it's a smaller area, you can use Compeed. But Compeed's very sticky and it will tear off you don't really want to use it over an intact blister. It will tear off that biological dressing if you need to take them off. So that's how you do that. All right, there was a question about drilling toenails. Yes, we can drill toenails. People get subungual hematomas or blood under the toenail often on these races. And if you ever have banged your hand inside of a car door, and your fingers starting to turn black, your fingernails starting to turn black, it's the same kind of thing. This repetitive pressure on the toenails will cause that. Allowing the blood to drain from that area will alleviate a lot of the pain and discomfort that happens with that. You do have 18 gauge needles in your kit. We're also happy to want to show you how to do this or do it with you, because it might be a little intimidating for some people. So just to wrap up very quickly, the rules of foot care: good fitting shoes can help prevent your blisters. Pre-taping can help prevent blisters if you're prone to blisters. I didn't mention it, but if you start to have a hot spot, stopping on the trail and putting a piece of paper tape over it to protect it will pay dividends in the long run and help prevent blisters. So make sure you do that. If a blister is small and it doesn't hurt, leave it intact. Try to preserve that top skin, that biological dressing of the blister, and then try to leave blood blisters intact as much as possible, but there are circumstances when they do need to be drained. And I think that's all I got.
Okay, thank you very much to our three medical experts. What they're trying to do is help you to prevent any of these issues, and that's primarily what we want to happen at any race, so that you, in your training, you prepare, you know where your weak spots are, you know what to look out for, but these guys are there with a team of between 4 and 6 or 7 doctors at each race to support you, answer your questions, and treat you if necessary. They're not your personal doctors or personal podiatrists, but they will support and help you to do what they can to get you through the race. So now we're going to move on to questions. I'm going to start, I know there's been a lot of questions in the chat, but with some of the questions that were submitted in advance of this call. Some have been answered already, but I'm going to hand over to the team. I think, Brandee, the first question is for you.
Yes. So how much support do we provide for musculoskeletal issues without DQing? So everyone should know that the medical team is there. The only reason we will pull you from the race is if we think you're going to significantly harm yourself. So, it's usually not for a musculoskeletal issue. If you've got a joint problem that's hurting, if you think you can keep going, you'll keep going, but you don't want to fall off the side of a mountain. Okay. So if it's that bad, you will pull yourself out. Most people pull themselves out if they have a musculoskeletal issue. We're there to help Some of the teams have sports medicine doctors. Some of the teams have all emergency medicine. So not all of the teams have a sports med doc. All the emergency medicine docs that do these races have some sports medicine training. So they'll do some basic musculoskeletal management, but you're not going to get a joint injection. You're not going to get a manipulation to reset, your mildly out of place kneecap or something like that. But we won't disqualify you. Our number one goal is to get you across the finish line. Our number two goal is to get you on an airplane back to your family. And we will only pull you out of the race if we feel like there's a chance that your medical issue is going to prevent you from getting on that airplane back to your family.
Okay, next question. Dr. Patrick, I think you answered this one already. Yes, they will drill your toes. Question for you, Patrick, from others. Does it hurt?
It shouldn't. So the idea is when you get to where the blood is underneath the toenail and it starts to drain, that's when you stop kind of twisting the needle. So if you stop in time and when the blood starts to drain, it shouldn't hurt. If it goes a little too deep, you might have like a tiny little bit of pain, but it doesn't hurt.
Next question. I don't know which one of you wants to answer this. I'm most concerned about heat stroke and heat issues and knowing what signs mean I have to pull out or rest.
Yeah, I can answer that. So heat stroke, heat issues, they sort of present with all the same symptoms as a lot of our disorders: headache, nausea, vomiting, kind of feeling really tired. Also, many people who just run an ultra feel that way. So this is a real challenging issue for us. If you are feeling any of those symptoms, every checkpoint's going to have shade. We're going to have spray bottles to start cooling you down. If you are prone to getting heat stroke, the thing that I would recommend the most is coming to the race early to acclimatize, as early as you can. Some people run with a buff that they put around their neck or on their, and wet it. So while they're running, the evaporation is cooling you down. So there are strategies that you can do to sort of cool yourself down during the race. But really the best strategy if you are feeling like you're overheating is to take a break at the checkpoint in the shade and just try to cool off there.
I'm just going to add to that very slightly.
Mental confusion. Oh, yeah.
So,
sorry, I was going to add that. The thing is, any mental confusion at all, then we're worried that you're starting to have bigger symptoms. So stop and rest, ask for help. And that could be from fluid or from heat or from anything else. It's the mental confusion is really like the key, this is about to hit the fan.
The other thing is that it's okay, don't feel like you're getting someone else in trouble if you tell us that, hey, my tent mate is not doing well, or I came across this runner who do you mind checking on him? It's totally fine to do that. We love for you guys to help be our eyes and ears because you're out on the course. And don't feel guilty about it, because we don't want to pull people out of the race just to pull them out. We want to make sure that they can complete it safely. So it's okay to tell us that you think that a runner needs help or needs a doctor to check on them too.
Okay. Avi, do you want to stick with this? Is there any product out there that has the same effect of Coca-Cola that we can bring to the races?
My suggestion is Pepsi. But there really isn't. There really isn't. Any sugary drinks will have the same effect, any sort of sugary effervescent drinks. So we actually have some runners who run with cans of Coca-Cola. I wouldn't recommend that unless you want a really heavy pack. But some people bring like one Coke for the long day. But any sort of sugary drinks really do the same effect.
Here, Dr. Patrick, is there anything that can be done in advance of the second day of the event to prevent blisters from wet feet? I think you've answered it, but maybe summarize here.
Sure. Yeah, I think drying your feet out in between the race, letting them, become less moist can be helpful. Drying out your socks. If you do have any hot spots, making sure you pre-tape them. That's helpful. But yeah, try and keep things aired out and dry. It's the best thing to do.
Yeah, and I guess clean your feet at the end of every day. Take
Clean
some
your
time
feet,
in your
sure.
tent with your wet wipes, and we'll give you a little bit of water. The doctors give you a little bit of water at the medical tent to keep them clean. ITB,
I can take the next one. This is
perfect. ITB and TFL
Yes, so
are my weak
Ilya-
spots where I usually have issues. How could you recommend managing or mitigating that in a race? Yeah, Brandee, definitely.
Yeah, so the iliotibial band and the tensor fasciae lata are at the outer hip. So ahead of time, training your glutes. So squats, particularly lateral lunges, bridges and Pilates glute exercises can help ahead of time. During the race itself, make sure you've got some good IT band stretches. There's some really good ones that you can do lying down in your tent. But also, if you can fashion some of your clothing to be like a little donut cushion, so that when you sleep on your side, that donut cushion is around the curvy part of your hip, so it spreads out some of the pressure. It's just sleeping on your side is going to irritate that on a hard surface. So if you aren't carrying a mat that's an inflatable mat, then bring with you something where you can kind of build a donut cushion around that pressure point, and that can help decrease it.
Patrick, my toes/feet get destroyed running in wet trail fit shoes. Any advice on river crossings other than bringing a second pair?
Yeah, that's hard. I mean, changing out your socks is helpful. I've seen people try and put their feet in plastic bags to do river crossings, but that's only going to be helpful for very shallow river crossings. Yeah, I think trying to air out your feet as much as possible after you do a river crossing is probably one of the more helpful things, and have dry socks to put on.
And Patrick, if they know
I
that
saw a couple of
go, Brandee.
Sorry.
I was going to say, I've seen a couple of ingenious runners who did actually their second pair of shoes, like their camp shoes were something that were more like Tevas or sandals that actually strap onto their feet. And if they have trouble with with running in wet shoes, they will stop at the river crossings, take their tennis trainers off or tennis shoes off, put on their Teva sandals that hold onto their feet well, and go through the water in their sandals, and then take those off, dry their feet, and put their shoes on. And that helps keep their shoes dry.
Yeah, that's helpful. I would avoid just, at least I would make sure you have at least something on your feet for the river crossings. There's rocks and stuff under there.
Yeah.
You don't want to go barefoot to help your feet, because probably in the long run that will be worse. But yeah, there's some competitors that run. We had a couple in Mongolia that ran in Lunas for probably almost the entire time, which was impressive.
Patrick, would pre-taping.
But if you don't train that way, don't try to do that.
Yeah, that's right, exactly.
Patrick, would pre-taping with elasticon or a tougher tape help for people who know that their feet get destroyed in river crossings?
I don't think it's really been studied with pre-taping with a thicker tape. It should work the same, similar. I mean, the reason that we advocate for paper tape is because it's thin and cheap and easy to carry. But yeah, maybe if you are prone to blisters in the same spot, maybe using a heavier tape would be helpful. But definitely avoid any of those heavier tapes on the toes, because they can lead to more blisters on the other toes.
Okay, more pre-submitted questions. So please compare all of the challenges of the Atacama with the Gobi March, highlighting the difference in prep and race approach. So these guys are just going to answer this question from a medical point of view, not from a race point of view specifically. Avi, do you want to take it, or do you want me to?
Sure. Yeah, the big difference to Atacama is it's at high altitude, and somebody asked a question about it in the chat as well. And so it's the camp one, I think, is about 11,000 feet, and Sam, maybe you can translate how many meters that is. But it's
about 3,000 meters.
Yeah, so that's the biggest issue. Atacama is also a hotter race, and there's more sand. But the big issue is the altitude. And so if you're, the best way to handle that is to come as early as you can for acclimatization. Acclimatization starts pretty quickly, and camp one is the highest camp that we have, and then you descend from there. So San Pedro is about 10,000 feet. We go up to camp one, which is a little bit higher. You can take medications to help with acclimatization, but medications, specifically acetazolamide, have some side effects that might not be conducive to an ultra. Like you can have numbness and tingling in your hands and legs. It makes food taste very different and carbonated beverage taste very different. It's also a diuretic. So that's how it works, is you pee out fluid to sort of help with the process that assists in acclimatization. So really ideally, coming early in acclimatization is your best bet. And even a few days early is better than nothing.
So the only other things to add to that is you will get your feet wet in the Atacama, but there's more river crossings in the Gobi March. So this specific question. So in terms of preparing your feet more for being wet for longer, and the climate is generally more humid or wetter in Mongolia at the Gobi March than it is in the Atacama crossing in Chile, where it's very dry. So in Atacama, things will generally dry faster because it's such a dry environment. In Gobi, your feet, your shoes, your clothes, anything will not dry as fast. So preparing for that.
Yeah. And along with that, I think the dry conditions of Atacama, people lose more water in general, just breathing, like when they're heavy breathing. And so they usually have to increase their hydration a little bit more than maybe they would in a more humid area.
Absolutely. And generally, the Atacama crossing is hotter during the day and colder at night in general and more consistently. So preparing for both of those, your equipment with the heat and the cold, so sleeping pad, a warmer sleeping bag, and in the heat, sunscreen, more electrolytes. And the terrain in the Atacama in general is more challenging on your shoes or your feet because it's not flat running trails. In general, it's sort of rockier, coral-like, less forgiving on your feet. I'm not going to go into more of that now, but I can separately, if questions aren't answered fully here, you can ask at the end or email us separately. Avi, do you just want to go back to what you said previously? What are the most common issues that you see with competitors in general?
In general, at all the races, the most common issues we see specifically in our non-Antarctica races are foot care. That's definitely the most common thing. And blisters, while medically are very minor, can be race ending. And so that's why Patrick was talking about just really caring for your feet. Those are the main issues that we see in most of our races, is musculoskeletal issues and foot care, basically. And people have backpacks that rub in different parts of your body. And then we do see some vomiting and diarrhea and also constipation. Somebody asked that question in the chat earlier. People eat food that's different. You're not eating low fiber food. You're drinking less water. So people get constipated. We have medications that can help you with that. If that happens to you, come see us earlier rather than later, because your colon is designed to suck fluid out. And so the longer you wait, the harder it gets. Diarrhea is common, unfortunately, in ultramarathons. And the thought is that so much blood flow goes to your muscles that you get a little less blood flow to your gut, and that causes some diarrhea. We'll have some antidiarrheal medications, or if that's a common problem for you, you should bring your own antidiarrheal medication as well. Usually this is a benign, not serious problem that kind of goes away when you stop running. And then lastly, since we're almost out of time, I just want to talk about Antarctica a little bit. We got a question: what are the 5 most common injuries or medical issues for Antarctica? Antarctica is a very different race. It's obviously not hot. And so we rarely have issues with any heat injuries, but we do see issues with people getting cold. And if you're going to Antarctica, you'll have a whole separate list of gear. And what happens is people are running, they're not really getting cold when they run, but they sweat a lot. And as soon as they stop running with wet clothes and sweat, their body temperature can drop really quick. Seasickness on the way down is can be really variable. Sometimes we have mild seas, sometimes we have pretty big seas. The Drake's Passage is considered the biggest seas in the world, and swells can be up to 20, 30 feet. And you can get medication and patches that you wear to minimize seasickness. So if that's something that is a concern to you, and I would say that most people haven't been in waves that are that big, so bringing medication for seasickness is a common one. We don't really see blisters in Antarctica. I think it's the lack of sand and feet getting wet. I mean, you are running in snow, but it's very dry. But we do see people like sprain their ankles and have some basic musculoskeletal injuries just from running in ice and snow. So that's one issue that we see in Antarctica as well. And then finally, sun and wind. Sun, you guys have all probably heard snow blindness. Everything is white and covered in snow. So UV light really reflects off the snow, comes to your eyes. And if you're not wearing proper eye protection, you can get UV damage to your cornea that's temporary, but very, very painful. And you can't see because your eyes just sort of spasm and close. And so wearing eye protection for both wind and UV protection is very, very important, as well as your skin, just to avoid sunburns and really windburn.
Okay, we do have one more page of questions, and then there might be other people. Provided the docs are okay to stay on, I'm going to keep going. For those who have to go in the time limit, that's okay, and this will be recorded. You can listen to the answers later. Otherwise, I'm going to carry on. So I think we answered this first question here about whether you can have injections at the race. The answer is no.
Yes, yes, we cannot do injections at the race, but for whoever has the Morton's neuroma, go ahead and get it injected because it's going to limit your training. And you want to be able to train properly, and it will only get worse when you're on the race. So I say go ahead and get it injected.
Great. Avi, do you want to summarize what medicine with a medical team travel with?
Yeah, we bring sort of emergency medical needs, so things that are required that if somebody has like a really severe emergency. We do bring some Tylenol or paracetamol, some anti-inflammatory medications and creams. But I would say that if you think you're going to need them regularly, you should bring your own supply so that you have them throughout the day and at camp. And then we'll also bring some basic antibiotics in case people have simple infections like a urinary tract infection or a cellulitis or an infection of your skin. But mostly we're there to provide sort of any emergencies that might arise. So if you think you might need some regular over-the-counter medications, I would say bring your own supply. But we have some things that we can help with: diarrhea medication, constipation, some nausea medicine if somebody can't keep fluids down. I will say that if somebody is vomiting a lot, really the treatment is usually just rest because people are overheating, they're getting a little hot and they start vomiting just from being tired and exhausted. And so really the first treatment is just kind of resting so that you can start rehydrating.
I'm just going to add to that. So the medical team, they also have with them normal saline IVs, they have with them ACLS emergency medications, they have with them a defibrillator, but any use of any of that kind of medication does mean you're out of the race, and that is solely to prevent you getting worse so we can get medical help. So they have a lot more than Avi has just mentioned, but that's for emergencies to be able to deal with a worst case if it were to happen, and it very rarely does get used. I'm going to move on from the research studies for now, just because that could be a very long answer. Patrick, do you want to answer quickly? What have you seen with wide toe box shoes such as Ultra?
So as someone with what I call duck feet, I'm a huge fan of Ultras. I really like them. That's what I run in preferentially. I haven't really noticed any specific issues with anybody else running with them necessarily. So yeah, I think if you train with it, it works good for you. You have wide feet. I think they're great.
So in summary, choose a pair of shoes that fits your foot. If you have a wide foot, make sure you have a shoe that's wide enough, and it'll be good. If you have a narrow foot, don't wear a wide shoe. It's not going to help you. I guess on the toe box side of things, is it worth having a shoe that has a wider toe box or a closer fitting one?
Again,
totally
I think
depends on your foot.
Comfort.
Great. An interesting question: how to use and practice a venom pump. So let me first of all say we don't require you to bring a venom pump to a race. From that point, I'll let Avi continue.
Yeah, venom pumps don't work. They are these suctions that you in theory can suction out venom from like snakes. They just don't work. They just cause damage to your tissue at all. You cannot suck venom out with a venom pump. We do have races that have scorpions. We've had, as far as I know, maybe just one scorpion sting that are no big deal. It's like a bee sting, but we always ask people to shake out their shoes and clothes that might be on the ground before putting them on. And we've never had a snake bite. We do have races that have snakes, but I would just take care of, looking out for snakes. But if somebody got bit by a snake, we would probably mandatorily take them to a hospital. But we don't carry venom pumps. They don't work. The treatment is really anti-venom.
Which we can't carry at a race because it has to be kept at a certain temperature in certain conditions. Next question, how many kilocalories, how many calories do you suggest to take per day during the race? As they point out, the minimum you have to bring is 14,000 calories for the 7 days. And that's from Sunday morning from when the race starts until Saturday, 7 days later Saturday morning when the race finishes. I think it's probably a good question for Patrick to start with, having raced.
Yeah, that 2,000 is, I definitely went over the 2,000 calories when I went. But some people do it and they're fine and they're happy with the weight that they're bringing. Again, it's going to be individual. How much you feel like you need, how much you need to feel like you're satiated. I maybe brought a little too much of calories. I think I brought like 2,500 a day. But I was glad to have the extra.
Just from experience from other races, like people, it's safe to be able to race on 2,000 calories a day, but you will be hungry. And almost everyone, including the guys at the front, bring more. And I think, Patrick, your summary of 2,500 calories per day is about right. I would suggest don't plan to bring more than 3,000 a day because it will just make your pack heavy. You may eat it, but you know yourself, so plan based on that. But you have to have 14,000 calories for the week, which is 2,000 calories a day, and perhaps consider 2,500 per day. But obviously don't necessarily plan it each per day because the long day is over 2 days. So think of it planning based on the race, not just based on the days.
And there's lots of great foods out there that you can take that are calorie dense that don't weigh very much. Remember, like, try to avoid the foods that have like lots of water content in it because you're just carrying water basically.
One other key move is if you're particularly sensitive to different foods too, to maybe consider bringing your main foods in your carry-on bag, or if you're checking more than one bag as you travel, to split your foods between the two, just in case you lose one or something gets lost on the way, that you're not starting from scratch in a remote area that may not have the type of food that you trained with.
Excellent. And we could go on, but I don't want to turn this into the food chat. So I think moving on, keeping it medical. So the final question, I think, and I'm going to answer this. So you are still, for 2023, required to bring 7 face masks and 3 COVID tests. The COVID test can be put into your drop bag, which is an optional item where you can have just an extra sleeping bag or blanket, so you don't have to carry it. The reason we're still asking this is because if there was an outbreak of COVID, and we recommend then that people would use their tests, if everybody had to test every day for a few days, it's impossible for us to bring that many in. So that's why we ask you to bring your own. The chances of you using them is slim, but bringing 3, they're so easy in most countries to get hold of and not expensive and not heavy, that for this year, we're still asking you to bring those. A quick note, I don't know, Avi, do you want to touch on it and what happens if someone does test positive for COVID at a race?
Yeah, typically, we've had people test positive for COVID, and almost everyone, I would say you should withdraw from the race. One, we don't want to spread it to your tent mates, but 2, people just feel real lousy and they have a hard time running and even walking when you have COVID. So if you do test positive for COVID, I think we would pull you from the race.
but that does depend on what your symptoms are and whether it's healthy to go on. But we would definitely separate you, isolate you from in a separate tent so that you're not spreading it around camp in the situation where you could be allowed to carry on. Okay, that brings us to the end of the pre-submitted questions. I know that we're a long time over, but if there's any questions that people haven't asked in the chat or didn't pre-submit and they want to ask now, you can unmute yourself and take advantage of the doctor's time whilst you have them here. Any more questions? Are there any, I'm not trying to prolong it, but were there any questions in the chat that are worth bringing up to everyone in case they didn't see them? Or were they all very personal?
Just one question, because I'm not familiar with the issue of the acclimatization. What is considered to be a considerable good time for acclimatization, knowing that 2 weeks for most of us is impossible? So it's depending. Should it be around 3 days to be the most efficient? I mean, in a specific time frame.
Are you talking about altitude or heat?
No, just heat. Just heat. It's for Jordan, so there's no altitude or anything.
Yeah,
and it's not too hot, I suppose.
Yeah, acclimatization starts right away, so even a few days is better than no days. Full acclimatization takes 1 to 2 weeks. Everyone's a little different. So I think even coming a few days early is really going to help you to be in that heat and getting yourself out there. Don't just stay in the hotel, you know, go walk around town or go for a run to try to get used to that heat. So even a few days early is going to be advantageous to you. And you'll continue to acclimatize throughout the week as well.
Thanks.
I had a quick question, if possible. If we are getting a shot for neuroma, does that take us out of training for a couple of days? I think she mentioned something, but I didn't quite catch it.
I have a feeling Dr. Brandee had to leave the call. Patrick or Avi, do you know the answer to that?
Yeah, typically they'll tell you to not do anything for a few days afterwards, and then gradually increase some more as you gradually increase your activity. But usually they'll have you stay off of it for a few days.
Like 2 or 3 days?
Yeah, it's not that long.
That's long and training. Okay.
Well, yeah. Yeah.
I'll check in with my podiatrist. Okay, thank you.
Yep.
Last chance for a final question before we close off the call. Okay, on that note, I just want to say thank you so much to Dr. Avi, Dr. Patrick, and Dr. Brandee, who has had to leave already, for taking the time to go over these common issues before, during, and after a race and answering people's questions. So thank you, the three of you, very, very much for your time. Avi, we'll see you in Jordan. Patrick, we'll see you next year. And Brandee, we'll see you next year as well. Okay, thank you all very much for taking the time to join, and big thank you to the doctors.
Thanks all.
Thank you so much.